please, I'll call you back. Hi. Shh, it's okay. I can't believe you just woke up. Oh my gosh, I don't know what to do. I'm sorry. Hi, my name is Ivana. I'm your nurse, I guess. Well, I'm actually an intern, but I was told to look after you. Well, the nurses, like the real nurses, went on their lunch break. I don't know if you remember this, but, well, I mean, you wouldn't remember this, but you've actually been in a coma for the last, 12 years or something. Yeah, and I was told to kind of look after you, but I did not expect you to wake up. Not in a bad way, I'm sorry, that came across really weird. I just meant I didn't expect you to wake up while I was on shift. Yeah, it's actually my first day. I'm kind of new to this. The nurses said just watch you, but there's like a 0.8% chance that you're actually gonna wake up while I'm here. But you have, so what do I do? I swear the craziest things have been happening to me all week. It's like Mercury's in retrograde or something's going on with the moon. I have no clue, but this is insane. I guess I should try and help you. What's your name? Oh, you may not remember. I actually have your files here. Your files. Yes, I do know how to read this. Okay, so it says you've been in a coma. I know that part. At this hospital for 12 years now. You've been moved between hospitals, but you've been in this one for 8 years. And you are needing vital treatment if you do wake up instantly. Vitals. Yes, I think I know what that means, and I think I know what to do. Yes, please don't panic or worry. I actually have some training under my belt. Yes, I've done a course in nursing. It was like a 3-week course, but I'm just really excited. I feel like on-the-job experience is just way more beneficial than sitting behind a computer and doing all that annoying writing and assignments and paperwork and learning and yada yada yada, right? It's nice to meet you, by the way. Did I mention my name is Ivana? Sorry, I'm just a little bit nervous. I was not expecting this at all. Yeah, so you just lay back and, well, I guess you already are laying back. You've been laying back for a while now. I'm just gonna see what kind of stuff they've left me here with, and we can kind of figure this out together. What do you think? Okay, so, there's a lot of fancy equipment here. I don't know what I'm supposed to do with this. Oh, I know what this is though. It's pink. It's like they knew I was on shift today. They prepared for this moment. Okay, so I know what this is. I watched a lot of videos on doctors and things like that before I came here, so I'm just gonna check your vitals and I don't know, whatever else I need to do. Okay, so I'm just gonna kind of put this near your chest. You can just relax and just lay down, okay? Breathe in. Good. I can't believe I'm actually doing this. I did not expect to be actually properly checking someone's heartbeat on my first shift. My dad was saying, well, he was saying I wouldn't be able to actually do any hands-on jobs for at least 3 years. My dad actually runs this hospital. He owns it, yeah. So can you just breathe in for me? I'm just gonna put this on your back. It might be a little bit cold. Yeah. So I guess that means this hospital will be mine one day, right? Will I be a business owner? Is that what that means? Oh, can you imagine me being a business owner? Can you just breathe in? I'm just gonna put this. Your heartbeat sounds really good. Wow, very steady. Considering you've been half dead for 12 years, I don't know if steady means a good thing in this particular situation. I feel like it's better if your heart was do-do-do-do-do. It means you kind of have more life to you. You look a little bit still kind of out of it. Don't worry, I know how you feel. I get out of it all the time. it's just like hard to like, every time I have to go up the escalators here, which has been like once because this is my first day, I get like really dizzy and I don't know, it feels like really weird. So I totally get how you feel being like out of it. Yeah, I'm just gonna kind of feel around your face here, check your pulse. I know how to do that. Feel around your pulse here. Okay, try and breathe in. Yeah, just breathe. Just try and relax. I promise I'm gonna take good care of you, okay? So, let me have a look. This is so professional. So, your name, your age, your date of birth. Wow, you've wasted a lot of years in here. Not many to go. I don't mean it in a mean way. I just think it's like better to know that you've wasted a lot of years. So it's time to, once you leave this hospital, once you're dispatched from here, to kind of make use of the extra time you have. Life's short. That's what I tell me and my besties all the time. I write about it on my blog. Life is short, so once you get out of the coma, try to make the most of it. Yeah. So, I think I need to nerve exam, check your senses, I think I need to check your senses. I know, I'm going to perform a little bit of a cranial nerve exam, which means I'm going to kind of check all your senses to see how they're working after you've kind of been in a horrific state for as long as you have. It could mean that your hearing isn't where it should be. Your eyesight might be a little bit blurred. Maybe your sense of taste isn't exactly up to par. Yeah, so I'm just gonna perform, I guess, a few different procedures. I've never actually done this before, but you know, I have watched a few cranial nerve exams on YouTube, just for fun, like, and I think I can try my best to figure it out. What do you think? Happy with that idea? You seem to be shaking your head. Well, I mean, the nurses should be back from their lunch break soon. I mean, I am technically a nurse. I don't mean to like downgrade my abilities here. We want to have like a growth mindset coming into our first shift, but the more qualified nurses will be here soon. But I feel like I can just try and take care of you while they're away. Okay, perfect. So, cranial nerve exam. So I checked your heart rate, your vitals. That all seems perfect. Now, I guess I can start with a bit of a sensory touch test just to see how your senses are reacting after being kind of stale for a long time. And I really don't mean that in a mean way, I promise. I totally get what you're feeling, like feeling out of it. Like, as I said before, I feel that way a lot of the time too, especially after I've had a long night at the club. So I'm just going to kind of, ooh, this looks, we can use this. I think it says swab on it. Okay, so I'm just gonna kind of open this up. Ooh, look at this, how cute. And we're gonna kind of do a little face sensitivity touch test. What do you think? You seem like you're not very responsive right now. Totally fine, we'll get to that problem in a moment. But I'm just gonna get you to tell me when you feel this little cotton swab come close to your face, okay? Perfect. So kind of like, I guess you could keep your eyes closed. You may not want to after you've had your eyes closed for over a decade, but you know, we can close them for a little bit longer. Like, what's 2 more minutes? Yeah, keep them closed. Oh, so close. I'm gonna come in with this little swab here, okay? Are you ready? Did you feel that? You just have to like say when. Okay, so keep your eyes closed, and as soon as you feel it, just touch your face. Just say like, I feel it, or like, I don't know, whatever you want to say. Just say the last thing you remember before you kind of like passed out. You know, just to make things a little bit more fun and exciting, okay? You felt that? Perfect. And on this side. Oh, you felt that as well. Okay, what about up here? So keep them closed. Oh, we'll try that again. Oh, you seem to have some issues at the top here, yeah? not gonna do anything crazy. Pinch some points in your face, and you just tell me if you feel it, okay? It's very important to make sure you kind of wake up. This might actually help you wake up a little bit. Yeah. Okay, close your eyes. You're doing a great job already. I know it's kind of hard to follow instructions after being in a very tragic... What were you in? Like an accident? I don't know. I didn't really check your files. Okay, ready? You felt that? This is so crazy. You know, I cannot believe that this is actually happening to me. You know, this is not the first thing that's happened to me all week. That is just blowing my mind. I actually went to Air One the other day, or was it like, not the other day, like the other week or something, and I ran into Mark Wahlberg. He was like behind me in like the checkout line. He like bumped into me. It was really rude actually, but you know, people, celebrities, people too, like they get a little bit cranky, whatever. So I'm like, okay, whatever. Anyway, so I walked out of the store, and guess the notification that came up on my phone on Hinge? It was a guy named Mark. How crazy is that? It wasn't like Mark Wahlberg, obviously, but like 2 Marks in like 5 minutes. Yeah, and then I come here to work, and this happens. Like, you actually wake up for the first time. Sorry, are you feeling this, or am I just kind of like pinching randomly? You are feeling that? Okay, good. So, yeah, it's just crazy that now this is happening. It's like a crazy array of events in like a fortnight, you know? And I should be going backstage to some concert tomorrow night, so that's like another crazy thing that's happening to me. It's just like, I don't know, something's in the air. It's really weird. Okay, so your senses seem to be working correctly. I'm just gonna kind of pat around slightly, very, very gently onto some points in your face, okay? Okay. Tell me when you feel the glove, okay? Do you feel it? Are you feeling the glove? Are you feeling any kind of numbness or anything like that? Yes, you are. Okay, should I note that down? I probably should, but we're just gonna continue on, okay? So I'm just gonna kind of feel around this side. Perfect. Okay, amazing. You're actually doing such a good job for someone who hasn't been alive for ages. So now I'm going to do a little bit of, I guess, an eye test. I should probably do an eye test, right? It's probably not the healthiest thing in the world to have your eyes closed for a long time, right? Like, you kind of have to like move around and kind of look at what you're doing, and I don't know, get a better sense of existence. It's what I read in a book, actually, like a philosophy book, whatever. You need to actually have an open mind, open eyes to experience life to the fullest capacity. And I don't believe what you have been going through in this hospital has really lit up to that expectation of life. So I have a light here, and I'm gonna kind of check your pupils reaction, and you're just gonna kind of follow this light for me, okay? Yes, you're doing such a good job. I understand things must be really scary for you right now. I promise I'm trying my best to take care of you. Yeah. Okay, so love, just have a look at this light here, okay? And if you can, just follow it. If you can't, I won't be mad at you, okay? Now. Okay, wow. You're actually killing it. Good on you. This is really impressive. I honestly don't think I could do this if I was hungover. Never mind been in a coma for like, I don't know, what is it, like a century? Okay, keep following it. Sorry, do you mind if I just call Stacey back? I literally hung up on her. I was like super rude. Hello. Hi, babe. I am so sorry about before. Yeah, no, you would not believe, like, trust me, it's for a good reason. You know how I said I was like interning at that hospital today? Yeah, well, basically, you know that like coma patient that I was like briefly telling you about. So they actually woke up. I know, you're not gonna believe it. It's crazy. Like, and I am looking after them right now. Look at this light. Yeah, just follow the light, okay? No, they're not scary. They're actually really sweet. Yeah, no, it's totally fine. I'm just like really excited to finally have some proper work since like bar hopping for forever, right? I know. Maybe I can get you a job here. Should we do this together? Can you imagine we like work at a hospital together? that's super in, right? It's gotta be like some Grey's Anatomy, whatever. Is that like the show, the Grey's Anatomy show, whatever, like that hospital show? We could be those people and wear like cute little outfits. What do you think? I can ask my dad if he can get you a job here. At the light, yeah. He'll probably say yes, you know. I don't know. We'll see. I'll get back to you, okay? I love you so much, girl. Bye now. Okay, so this light test has actually been very successful. I'm noticing, well, I didn't really notice too much, but you are keeping your eyes open, which is a very good sign, I think. Usually if you've seen light in your eyes for the first time in a long time, you can kind of like be squinting and stuff because it's probably like bad for your eyes. I don't know, but you're actually doing a really good job, so yeah, I would note that down. Super exciting. Okay, now, so we've done sight, we've done touch sensitivity. Now we're going to do a little bit of a smell test. Actually, yes, we'll do a smell test first, okay? What do you say? We need to do this, okay? Because we need to make sure that your senses are working correctly, okay? It's very, very important. I know this is a little bit of a drag. Yeah, okay. So let me see what they've left me here with. This is so exciting. It's like playing doctors. So I have like some tubes here. I think they're used for cranial nerve exams. Okay. Oh yes, they have like specific scents inside these tubes. I guess that means they're good for like smelling and stuff, right? So what we can do is I've just opened this one up for you and just breathe in as much as you can and try and describe the aroma to me. Yeah, it's kind of like you're in a massage, right? Okay, open your mouth, sorry, I think I'm hungry. It's been a while. Just smell, yeah. What does that smell like? Ew, that is disgusting. Oh my gosh, that smells like, I don't even want to say, something my ex used to have. Okay, try again. What do you think it is? I don't even know what it is. Let me read it. Oh, it doesn't really have like a clear description on it. Do you want to take like a random generated guess? You have no idea. Okay, well that's probably not a good sign. Yeah, I will probably have to take note of that since your smelling is not to the correct standard, but we can try again. You want to try again with another one? Okay. Take a whiff. Ew, these are really gross. I'm sorry. Do you know what it is though? Maybe it's like yellow flavor. I don't know. You don't know either. That might not be the best answer. I feel like there could be something going on with your sense of smell. That's okay, not to worry, not to worry. There's other tests we can do. That doesn't mean your sense of smell won't return. It just means it might be a little bit off since, you know, the accident or whatever is going on here. Okay, now let's do a really fun one. Should we do like a taste test, like a taste sensory test, right, to see if your taste buds are working? Okay, I don't know if it's gonna be like keto samples or anything like that, so just let me know if you have any like dietary requirements or anything. But let me see what they've left me with here. Ooh, what is this? Interesting. Okay, this looks like it can be used. So I'm gonna get this little doesn't remind you of anything, huh? Maybe those aren't good examples. Let me see what I have in my bag. Let me have a look. Okay. Okay. Ooh, this might be a good one. Do you wanna have a? We can try my perfume. Yeah, it might actually work a little bit better. Oh, it smells so good. Okay, I'll put this on a little cotton swab for you, and you can give it a little bit of a taste. Oh, this is gonna be great. Okay, open your mouth. What do you think? Your eyes are getting watery. Is that a good sign? I have no clue. Try again. Do you like it? I know, my bestie gave it to me. It's super sweet, right? It's like the perfect amount of like a woody scent versus, but it's not like super overpowering, right? Like I feel like I could wear this to work. Do you think? I feel like it is like a work scent. Okay, let me see what else I have in here. Okay. I know. I have a lip gloss in here. It's basically like a plum flavored lip gloss. I think you'll love it. I'll get another little cotton swab for you. It's totally edible, I promise. Okay, open up and tell me what this tastes like. Oh, I accidentally gave it away. Oh, it's okay. It's alright. Just tell me in your own words what this tastes like to you. Okay. Do you like it? It's really good. It's super moisturizing. You could probably use a little bit like on your lips too. Yeah, just kind of open up. I'm just gonna put some on your lips. They are super cracked and dry, but I guess that's to be expected when you haven't moisturized in over a decade. Okay, I told you I was going to look after you, you know. That's why I'm here. I'm a nurse after all. Okay, perfect. Ooh, I have one of my serums in here. I just bring it everywhere with me, you know. You never know when you're gonna need like a little bit of a touch-up, right? Would you like some? It's probably good for you, you know, your face. I mean, like, I don't mean to be rude. I know everyone goes through different skin phases during the winter. Our skin seems to dry up a little bit, but you do have a lot of kind of dry skin around your nose area and around your lips and just in your T-zone here. Do you mind if I put a little bit on your face? It'll do you a lot of good. I mean it. Trust me, if I was in your condition, I would be like reaching for any sort of moisture or hydration, okay? And I don't mean that in a mean way. Okay. I love how this is literally turned into like a spa. That is like my second favorite job. If I was to become a nurse, I think I would be like an esthetician or whatever it's called, esthetician, a beauty therapist, like by night, like nurse by day, beauty therapist by night, party during the day. What is this saying? Work hard, play. I don't know. How many times was that? Oh my gosh, I was just kidding. Don't worry, we'll play it properly. Ready? 2 times, 2 times. Good job, good job. Oh, it's so nice. I feel like my mind has been expanded today. You know, it really is true that you learn more from on-the-job experience than in any study hall, in any, you know, on any exam, in any assignment, essay, whatever they do nowadays. This is how you learn. This is the way forward. I'm gonna check your vitals one more time, okay? Just to make sure that nothing has gotten worse, or there's no, like, I don't know, like heart murmurs, so I'm not quite sure what I'm supposed to be looking for exactly, but we'll figure this out together, okay? If I notice anything different from the first time, I'll just let you know, okay? Okay. This is so crazy to me. I need to write about this on my blog, I'm so serious. Okay. Oh, I was kind of checking your forehead. Let me check your heart. That's probably what I should be doing. Okay, so it seems to be beating really, really quickly. I'm sorry, I'm just trying to get a bit of a comparison here. Which side is the heart on? Is it this side? I can't really hear anything. I think, is this even a... Okay, so our heartbeats do sound a little bit different. I'm not sure if that's like biology or just like body autonomy. If that's like normal, or if you're falling back into a really severe coma for another decade. But I will leave that not up to me, because I don't want to give any wrong advice or opinions. I'm actually just here for the vibes. Okay, so you seem pretty relaxed, which is good. Let me see if I can just kind of feel around your face a little bit. How's that sensory, those nerve endings going in your face? If I was to kind of like poke you, how about I just kind of poke you a little bit more? Are you starting to get a little bit more feeling back, like at the top here? Like before I noticed, you know, you had some sensory issues near your forehead. Has that gone down a little bit? You don't know? Okay, well what about if I just kind of like do that? Do you feel anything there? Yes, okay, perfect. I'll look in my purse just to see what else I can have a mess around with before the nurses get back. Well, like the highly trained nurses. I am a nurse. As I said, I don't want to speak down on myself. We're gonna get there one day. So I'm just gonna kind of brush your face a little bit. This will kind of help with kind of getting your senses working again. What do you think? Hello? You're not really responding to me. Hello? Are you awake? Are you awake? Oh my gosh, are you serious right now? Are you actually sleeping? You're crazy. Don't tell me you've fallen into another coma. Try and wake up, okay? What have I done? Did I just kill them? Surely not. Let me test their heart rate. Okay. Heart rate is beating. Phew. Maybe they're just sleeping. Hello. Hi. Try and wake up. I was supposed to keep you awake. Oh well. I'm so gonna get fired for this. I cannot tell my dad. Oh well. Hey Stace. No, I'm not busy, no. Yeah, I'm still with them. They're just like having a nap. Yeah. Oh my gosh, are you serious? I love that